Color-coded tops for a blood draw. The phlebotomist knows which color-coded top to use depends on the test that is ordered. This is the key to ensure the integrity of the sample. Each combination of additives is distinguished by a different color top on the evacuated tube. In some situations, the requisition might indicate which color top to use. In other cases, the requisition or prescription may only specify the test, so the phlebotomist must know which tube to use. Note: trace elements in blood collection supplies can contaminate samples collected for trace element analysis. Consult the laboratory for sample handling details. Yellow sterile. The test for that is blood culture. The additives is sodium polyanethyl sulfonate, which is SPS. It inhibits phagocytosis, which is digestion of microorganisms. The specimen that we use is the whole blood. We invert 8 times. Notes on process: recovers microorganisms that are causing blood infections. Do not confuse with non-sterile top of same color. The non-sterile yellow top tests for human leukocytes antigen, which is HLA studies, used for paternity testing and tissue typing. The additive is acid citrate dextrose. The specimen is whole blood. Inversion number is 8. Notes on process: none. Do not confuse with sterile top of same color. The next one is light blue. That is used for coagulation testing. The additives is sodium citrate. The specimen is plasma. The inversion number is 3 to 4 times. Note on process: must fill tube completely to maintain the ratio of 9 parts blood to 1 part sodium citrate. The next one is the red plastic. The test is chemistry and serology. The additive is clot activators. The specimen is serum. Inversion number 0. We don't need to invert that one because it have no additives. Well, it does have clot activator, but it doesn't need to be inverted. Now the red glass tube also tests for chemistry, serology, and blood bank. That one have no additive because it's a glass. The specimen is serum and it does not need to be inverted. Notes on process: blood collected in a red top glass tube must sit 30 minutes to clot. Serum is separated by centrifuge after clotting. And the plastic red top tube is the same. It must be sit for 30 minutes before centrifuge. The next one is going to be gold. or red-gray stopper. The test is most blood chemistry. That one, we use a clot activator plus a serum separator, which is called the thixotropic gel. The specimen is serum, inversion number 5. Notes on process, none, aka serum separator tube, which is the SSTs, star tubes, tiger tops, and jungle tops. After the gold, it's going to be green. The green test for stat blood chemistry, ammonia, electrolytes, and ABG, which is arterial blood gases. The additive here is sodium heparin. It may have gel. The specimen used is plasma. Inversion 8. And the next in line is going to be lavender. Lavender test for CBC, which is complete blood count. The additive there is EDTA, and we're using a whole blood, and we invert 8 times. Notes of process. Lavender is most common blood test, so lavender tops are the most frequently used. The next is going to be gray. So that's all the order of draw, gray. Gray test for glucose. So it's a glucose tolerant test, which is GTT. Lactic acid measurement, glucose tolerant test, which is a GTT. Fasting blood sugar, which is FBS, and blood alcohol level. The additive here is sodium fluoride, iodonoacetate, may also have anticoagulant, which is a potassium oxalate or heparin. The specimen is plasma, inversion is 8 times. Note process, fluoride prevent glycolysis, which is the metabolism of glucose. So that is the order of draw. So now I'm going to read the rest. Black. Black tests for erythrocyte sedimentation rate. So black test for sedimentation rate. The additive is sodium citrate. The specimen is whole blood. Inversion 0. Notes on process, no inversions because everything must settle in a sedimentation study. Must fill tube correctly to maintain the ratio of 4 parts blood to 1 part sodium citrate. And then the next one is the light green or green gray top stopper. That test is a stat potassium. The additive is heparin and a gel separator. So lithium, heparin, and thixotropic gel, which is a serum separator. The specimen is plasma, invert 8 times. Note on process, none, aka plasma separator tubes, PSTS. So the light green or green gray stopper is a plasma separator tube used for stat potassium. and the green is used for stat, blood chemistry, ammonia, electrolyte, blah, blah, blah. The next one is going to be orange or yellow gray stopper. That is also used for stat, blood chemistry. The additive there is thrombin, and the specimen is serum, and we're going to invert 8 times. Allows for 5 minutes of clotting time for patient on anticoagulant therapy. The next one is going to be royal blue. The test for that is toxicology, trace metals, nutritional analysis, and the additive there is EDTA or none. The specimen test could be plasma or serum. Inversion number with heparin and EDTA would be 8. If it's no additive, is 0 inversion. The notes on process is none. The next one is going to be TAN, and TAN tests for lead analysis. The additive there is EDTA. The specimen is plasma. The number of inversion is 8. The next is going to be pink, and pink tests hematology and blood bank. Remember, hematology is a study of blood, so the pink is hematology and blood bank. The additive there is EDTA, and the specimen is whole blood and plasma. Inversion number is 8. Note on process, none. The pink tube is similar to the lavender tube, but its closure and label must meet the standards set by the American Association of Blood Banks.